evening. We have here Scott Newcomb from KBM Management and One Digital. So he will be walking us through our Medicare plan. That will go from about 3:30 to 4. And at that point, we'll invite anybody that has any questions about the Medicare plan next door to a conference room where Scott will be available, along with Kim Martin from BOCES for any questions that you might have. And then at 4 o'clock, we'll shift over to the active plan with MVP, and we'll go over that information. So from there, Scott, take it.
Good afternoon. As she said, my name is Scott Newcomb, and I'm with KBM Management. We have Humana is on a Zoom call here who will actually do the presentation of the new plan that will be starting on July 1st. And I will stick around after the presentation to answer any questions. If there are any questions I'm not able to answer, I'll gather the information and we'll definitely look into it for you, and I'll get back to you directly on all that. Jody is the account executive from Humana that will be working with this group going forward. Do you have a question?
Yeah, I've only been on Medicare. This is my first year, but ours is Excel. It's not Humana. Is this going to apply to us at all?
Yeah. So I don't know if you're aware, but Excel is the current carrier for the Medicare Advantage plan. Mm-hmm. But unfortunately, due to some significant changes to their plan, the district had, or the DCMO, the consortium basically, wanted to see what other options were available out there from other carriers. We did a proposal, and Humana actually was the one selected to start providing your benefits as of July 1st of this year. So it will be switching from Excelis. It's switching from Excelis Blue Cross Blue Shield to Humana on July 1st. Okay, Jody, you're all set.
Okay, thanks, Scott. Hi, everyone. My name is Jody Haywood. As Scott said, I'm the account executive for the DCMO BOCES account. I'm in Louisville, Kentucky, and I'm going to talk to you about your new plan that is effective on 7/1. We're going to talk, just give a short refresher on Medicare and how it works. I'm going to talk about your plan, how it works for you, what you have to do to enroll, what you can expect after you enroll in the plan, and some extra benefits and resources that are included in your plan at no additional cost. So I'm going to give you this quick refresher guide on Medicare and how it's different from Medicare Advantage. So we know that Medicare is a federal health insurance program for those who are 65 and older, or if you qualify for disability if you're under 65. And you have your Parts A and B, which is original Medicare. Part A is your hospital insurance, everything that when you stay in the hospital, and then your skilled nursing, and if you have home health. Your Part B is your doctor visits, outpatient care, screenings, and shots. So A and B has always been original Medicare. And then there's Part C, and that is your Medicare Advantage plan. So with the Part C, it's Parts A and B and bundled with the plan. And they can include prescription drug, which is Part D as in dog, which your plan does include. So you have a Part C Medicare Advantage plan that includes A, B, and Part D. I'm going to tell you about just a couple of, one other way to get your Medicare. Sometimes you have friends or family that are on a different plan, and so you like to talk about, what the differences are. So this is just a little education so you can really know what the Medicare Advantage plan entails. So the options are, you can have original Medicare, and you can have your Parts A and B, and then you can choose to add a standalone prescription drug plan, because the government says if you're on Medicare, then you have to have a standalone prescription drug plan or you're penalized. And then if you want to add medical coverage to that, you have to get a Medicare supplement. So it's possible with this option, you're going to have up to 3 different cards to manage for your original Medicare, your RX, and your additional Medicare supplement. With the Medicare Advantage plan, like I said, everything's all in one. You must continue to pay your Part B premium, but it includes everything from Parts A and B and all the extra benefits I'm going to talk about. The nice thing about it is you have one card for everything. One card, one place to call with questions. If you go to the hospital, if you go to your provider, you go to your pharmacy, everything is one card. So just a little bit about Humana. We started out in the nursing home business in 1961. We are, so we've been around over 30 years. We have 8.7 million Medicare members across 50 states. We have our nationwide network of providers. So anywhere you travel in the United States, then you're going to have access to all of those providers. So no matter if you're on vacation or if you're a snowbird, anywhere you go, your plan's going to work for you. So let's talk about your plan. Your plan is a PPO, a Preferred Provider Organization. And this is an example of your ID card that you're going to receive in the mail. So with your PPO, you pay the same in and out of network services. You have no copay for certain preventive services. You have an out-of-pocket maximum, and it includes worldwide emergency coverage. So like I said, with your PPO plan, you're going to pay the same for in and out of network services. So no matter if you go to a provider that's in network or out of network, you'll pay the same copay. Now, if you have a doctor that's out of network and is not sure about that, they just have to be willing to bill Humana. They must accept Medicare and be willing to bill Humana, and you'll still have the same cost. If there's ever any questions about that, you can always call the number on the back of your card. You can reach out to your contact at the district, and they can reach out to Humana, and we will, on your behalf, call the provider and explain to them how the plan works. And then we'll reach out to you and let you know how your provider will bill Humana. So with your PPO plan, you have a $0 annual deductible. Your maximum out-of-pocket per year is $1,250. For your hospital care, for outpatient hospital visits, depending on what your procedure is, you get a $0 to $50 copay. For an inpatient hospital visit, it's $100 per admit, but with that, it's only a $300 maximum out-of-pocket per year. So if you went to the hospital, if you were admitted to the hospital more than 3 times, after that 3rd time, then you would not have a copay. Your primary care provider, as well as your specialist, are a $10 copay. The outpatient ambulatory surgical center is a $50 copay. And durable medical equipment is going to be 20% of the cost of the rental to rent your durable medical equipment. Your emergency room copay is $65 and a $10 copay when you go to the urgent care. You do have other benefits with your plan, which include hearing, vision, and acupuncture. For hearing, you have a $0 copay for your 1 hearing exam per year, as well as no copay for a follow-up visit. And then there's 2 levels for hearing aids. For the advanced level hearing aid, it's a $499 copay for a hearing aid up to 1 per year. And then the premium level is a $799 copay, hearing aid up to 1 per year. This does include 80 batteries per aid and a 3-year warranty. Your vision benefit is a $0 copay for your routine exam, which includes refraction, and then a $100 combined maximum benefit for your lenses, eyeglasses, and frames, and it does include options such as UV protection and scratch-resistant coating, and fittings for your eyeglasses. Acupuncture is 50% of the cost for up to 30 combined in and out of network visits per year. And as I mentioned, you do have your prescription drug that's included in the plan, and you would still use your same card when you go to the pharmacy. So this includes generic brands and specialty coverage, and you'll have access to mail order, which I will talk about. We have over 66 national, regional, independent, local pharmacies. So of course, this is going to cover all of your big ones, you know, the CVS, the Walgreens, all the big grocery stores, but this is going to include some regional and some local independent pharmacies. So if you have one of those, you can, we're going to talk about a way to get online so you can find out if your pharmacy is in network. Again, I said we'll talk about the generic brand and specialty drug coverage, and then also I'm going to tell you a little bit about the Inflation Reduction Act. If you follow some of the rules that Biden put in place last year, as of January 1st of this year, member cost share of all Part Ds and dog vaccines listed on the Advisory Committee Immunization Practice List are $0, and this does include the shingles vaccine. And then if you do take insulin, no one will pay more than $35 for a 1 month's supply. And this is covered under both Part B as a boy and your Part D benefit. So your Part D benefits will go through the tiers, which there are 4 tiers, and I'm going to talk about 2 different ways to get your medication. And one's going to be at the standard retail and a 30-day supply, and the standard mail order, which is a 90-day supply. When you go through the mail order, these are going to be your maintenance medications, those that you take all the time. These aren't going to be ones that you just go to your doctor to get filled once if you're sick or you need something just one time. And they just come in a 90-day supply when it comes through the mail order. So for your generic tier 1s, if you go to the standard retail pharmacy, for your 30-day supply, it's going to be a $5 copay. If you get that same maintenance medication through the mail order, you're going to get a $90 supply for $10 copay. So you can see you do have a copay savings there. Tier 2 is preferred brand, and that's $15 at your standard retail pharmacy for 30 days, and the mail order 90-day supply is going to be $30. And again, Tier 3 is a $30 copay for your standard retail 30-day supply, $60 90-day in the mail order. Tier 4, we do not mail specialties, and they only come in a 30-day supply, so that will just be your same $30 copay. Centerwell is our mail order pharmacy, and I always say it's just like your pharmacy that you drive up to and walk into. It's just, I call it the pharmacy in the sky. It's really not in the sky, but it's an actual pharmacy, and there's pharmacists that are working there. 2 pharmacists check every order. There's free standard shipping. It comes in discreet temperature controlled packaging. You can receive your refill reminders by email, text, or phone, however you would decide to do that. And once you get your ID card, you can contact Centerwell to set up your mail order if you would like to do that. I want to talk a little bit about Part B as in boy versus Part D. I think you probably heard me mention before, you can get your insulin in Part B or under Part D. Part B is your medical. And this is going to be things that are injectables given in your provider's office. So diabetic testing supplies, insulin pumps, insulin for insulin pumps, and CGMs would be billed under Part B, which is your medical, although you receive these items at the pharmacy. So sometimes when you notice if you're at the pharmacy and you have a different copay and you're questioning why, then you can say, oh, I remember. Jody was giving us a presentation and she talked about how the insulin was under Part B, our medical, even though I'm picking it up at the pharmacy, which the pharmacy would be at Part D. I know it makes it confusing. Humana doesn't make the rules. We just go by the government rules. So we try to just give you the information so you're a little more informed. Vaccines that are covered under Part B as a boy are the flu vaccine, pneumonia, hepatitis B, rabies, and tetanus. And again, even though you may receive these at the pharmacy, they will bill under your Part B medical plan. Now, Part D is going to be your diabetes medications, insulin, or that's used with syringes or pens, and then all of your other, syringes, pens, needles, and things like that. And all of your maintenance medication, these are going to be the medications that you pick up that are going to be in Part D. Vaccines that bill under Part D are some examples of shingles, Tdap, and hepatitis A. So really just what you need to know is sometimes it's going to bill under Part B and sometimes it's going to bill under Part D. I don't expect you to remember which one does which, but when you notice a difference in co-pays, that is why. So even when you're checking out at the pharmacy, if it's billed under Part B, it'll go through just as that. So you really won't know anything, just in case you're wondering what the difference in a copay is. For enrollment, all we need, we don't need for you to do anything. The district gets your information and gives it to us, and we enroll you in the Humana plan. You'll get your enrollment kit, which looks just like this kit right here on the screen, and that should be coming to you here just very shortly. Let's talk about what you can expect after you enroll. You're going to receive a confirmation letter from Humana once the Centers for Medicare and Medicaid Services, known as CMS, confirms your enrollment. And then you're going to receive your ID card after that. And so your ID card's just going to come in one long envelope. So just be on the lookout for that. Sometimes it gets tossed in the trash. We can always get you another one, but I just like to tell you to look out for it because sometimes people don't realize that that's their ID card. So it's going to come by itself in one long envelope. You'll also receive information on how to view or request a copy of the evidence of coverage document. So the evidence of coverage document is going to be that very detailed, really thick book that has every little detail of your plan and how it works and everything in it. We do not send this out due to the sheer size of it, but we will give you information on how to view it or request a copy if you want that. CMS requires Humana to ask new members to complete a health survey within their first few months of enrollment, and instructions on how to complete the survey will also be included in your enrollment kit. We have in-home health and well-being assessment, and this is a yearly detailed health review conducted in your home. Just provides an extra set of eyes, not replacing your doctor, just to come and check and make sure, maybe there's a fall or trip hazard that you're not aware of that they would see or something like that. So you could receive a call from one of our vendors, and that's Signify Health or Matrix Medical. This is completely optional, so if you want to opt out of this, you can just politely decline and say you don't want this service, but it is there for you. So there's easy ways for you to stay in touch and on top of your Humana plan. Once you get your ID card, you can set up for My Humana on your mobile phone with the My Humana mobile app. And it'll have, you can have a picture of your ID card on there. It'll have all your plan benefits. It'll have everything you need right at your fingertips. And then you can also go online and register at myhumana.com. I'm sure most of you have a primary care provider, but we'd just like to stress the importance of having a primary care provider that you're used to going to, that you've had for a long time, that knows you and your overall health history, that you can just build that long-term relationship with. So maybe if you do need to be referred to another doctor, you would feel good about that and they could communicate. So just somebody that's always there for you when you're healthy and when you're sick, and that's someone that you trust. So like I said, you do have the same benefits in and out of network, but if you would like to look up a provider or a pharmacy to see if they're in network, then you would go to humana.com/find a doctor. You'll enter your zip code and you're going to search your radius. Now, if you, like I said before, you can go anywhere in the United States with this plan. So if you're in Florida, you want to be sure to put the Florida zip code in. You don't want to put your home zip code in because the radius won't be large enough. So just depending on where you are, you want to put the zip code where you're located. Even if you're on vacation and you want to find a provider, then you can also, wherever you are vacationing, you would find the zip code there and put that zip code in. And then you have different options of how to search, and you can choose the Medicare or Medicaid option, and then you select the network that represents your plan, which is going to be the Medicare Choice PPO. Or you can use your member ID to sign in, or you can also, if you registered on your MyHumana, you can just go straight into your MyHumana to find a doctor. Telehealth visits are available through your Humana plan. Obviously, we were really, this was heavily utilized a couple of years ago during the pandemic. Not so much now, but if your provider offers telehealth visits, then you can use that with your plan with your same copay. And it might be nice sometimes just if you have the flu or a cold, you just don't feel like getting out and you know it's just something simple, the telehealth visit is available for you to use. Continuous glucose monitors and supplies are covered under your plan. And you can obtain your supplies and your CGMs from a durable medical equipment provider that accepts Medicare and bills Humana. Or now, just new this year, you can now pick up your glucose monitors and your supplies at the retail pharmacy. So you do still have to have your doctor's prescription for your CGM to pick it up at the pharmacy. So you can't just go there and get it. So you will need that authorization from your doctor, but sometimes that can be more convenient when you can just go to your pharmacy and pick that up. But again, note that that's not covered, even though you're picking it up, it'll be covered under your medical benefit, under your Part B. Our preferred durable medical equipment providers are CCS Medical and Edwards Healthcare. Your diabetic testing supplies are covered under your medical benefit. The Centerwell TrueMetrix Air, AccuCheck Guide Me by Roche, and the AccuCheck Guide by Roche. And again, your plan covers your testing supplies under your medical benefit, even though you're getting them at the pharmacy. If you've gone to your provider, or you've picked up a prescription in a month, then you're going to get your SMART summary. It's just like your credit card statement each month. That's going to summarize everything you did in that month, any claims that you've had. Now, if you did not have a claim in a month, you will not receive a SMART summary. But once you do have another claim, then you'll receive your SMART summary, and it'll keep giving you a tally of everything you did for the year. Okay, now I'm going to talk about some extra benefits and resources that are available to you at no charge with the plan. So first we have Silver Sneakers. Silver Sneakers is access to a facility, a gym, at no cost to you. And this can be for exercise equipment, group fitness classes, and even more so for social events. I know the YMCA does a lot of social events. So you would go to let's just give an example of go to the YMCA and show them your Humana ID card, and they will sign you up for Silver Sneakers, and it'll be at no cost to you. You can have more than one Silver Sneakers location, and even if you snowbird or you're on vacation and you want to use a facility, you can do that also. And if you would like to have, if you need to stay in, there's a Silver Infant, and you'll get that information in your enrollment kit. And that's a program that you can do at home. It's under Silver Sneakers. Also, to find the Silver Sneakers location, you would pull up silversneakers.com, and you'll put in the zip code, and it'll show you all the locations that are participating. Again, just like I was talking before, wherever you're located, you want to put in that zip code. We also have Go 365, which is a wellness program that rewards you for completing eligible activities at no cost to you. So we reward you by doing healthy activities with gift cards that you can redeem in our gift card mall. So this can be doing classes at the gym, or walking, or getting your preventative services, so things like that. And once you've earned at least $10 in rewards, then you can start going to claim your gift cards. At Humana, we have a lot of clinical programs for you. We have some wonderful nurses and care managers that are there for you to help you manage any conditions that you have, or if you're discharging from the hospital, if you have several medications, there's medication therapy management. You have multiple medications that you want to make sure that they're interacting okay, maybe you're getting in from different doctors, and you just need help staying on top of them, then one of our nurses will help you with that. We have behavioral health care coordination and consultation, as well as health coaching. Another benefit that's available to you at no cost is post-discharge services. These services, I think, are just absolutely wonderful. I can tell you from personal experience that and I just know how important they are. So if you have post-discharge from a hospital or a skilled nursing facility, you have available to you 12 one-way trips by car, van, or wheelchair access vehicle up to 50 miles per trip. And this must be used within 60 days of discharge. And I just know how important this can be. Say if you had knee surgery and you just have a car and you're in a wheelchair, then this is a great way to get home in a wheelchair accessible vehicle and at no cost to you. Also, the same way, if you were discharged, you would have access to up to personal home care, a minimum of 4 hours per day up to a maximum of 8 hours per day for discharge. And this is when a qualified aide would help you perform your activities of daily living, showering, bathing, anything like that if you needed that. They can also help you preparing meals or shop for you for groceries, perform some light housework, maybe make a follow-up doctor visit for you on the telephone. And so anyway, just a great service that's included at your plan, included in your plan. And so this personal home care service must be initiated within 30 days and utilized within 60 days. Another great benefit that people just rave about is if you have an overnight stay in a hospital or skilled nursing facility, you're eligible for up to 28 nutritious meals. 2 meals per day for 14 days. And we do have dietary restrictions, so you can put in there what they are. So we have different meal plans. This is a great benefit. People rave about it all the time, which is great if you go home, maybe you're by yourself, you can't get around. And you can't, have access to making your meals. So this is a great way to stay on top of it. We also have My Directives. It's an online tool where you can have all of your advanced care planning all in one spot. So it can help you in case an unexpected medical emergency or an illness. It would have all your providers, all your conditions, medications, everything in one spot. So those that are taking care of you will know how to find them. I mentioned health coaching before. So we have some great health coaches. I get excited about this because I would like to have a health coach that you can set up time to speak with one of our care manager or nurses to set up a health plan for you. And they will hold you accountable. They'll call you if you want, or if you don't want them to call you, they won't call you, but they're there for you. So I just think this is a great benefit also. And as I mentioned before, we have many clinical programs that are available to you to help you manage your health if you need it. Our case managers and nurses, like I said, are wonderful. They'll assist you through your whole hospital discharge plan and throughout treatment. We have disease management. If you maybe have a chronic or an acute health condition, then they're there for you to assist you, help you with what you need, and also let you know of any programs that may be available to you. Hopefully you never need a transplant, but our transplant management team is a great team, and they guide you from beginning to end. The same person is there for you from beginning to end to help you through that. And then again, I always like to talk about our Humana nurses. If you ever come into contact with a Humana nurse, they will give you a phone number. Keep that phone number. They're a wealth of knowledge and resource. They're always there for you. And then you can always stay connected with us. Like I said, you can use your My Humana, or we have our dedicated group Medicare customer care team there for you, and that's going to be the number that's on the back of your ID card. They're available Monday through Friday from 8 a.m. to 9 p.m. Eastern Time. So I know that was a lot of information. I think, Scott, I'm just a couple of minutes over, but I got it all in 30 minutes.
That was perfect. Thank you, Jody. I appreciate it.
You're welcome. Thank you for having me.
Can we get a copy of the PowerPoint? It explains it a lot easier than.
Yeah, so actually we have what we call a brain chart. There's a video presentation of the PowerPoint that we'll be able to share with you, all the retirees. We'll provide that to the district later today.
And everything from tonight is also being recorded, and all presentations will be listed on our retiree services webpage as well after tonight's meeting.
And I'll just add, everything I talked about today is in your enrollment kit.
Yeah, so that's a good point. You're going to receive one of these. Everyone's going to receive one of these probably next week or soon after that. This is what we call the welcome kit. In here, it's going to give you basically everything that you went over in this presentation is going to be included in your kit, including, the vision benefit, the hearing aid benefit, the prescription drug coverage, all those extra benefits that she spoke about. We're also available for any questions, especially until you learn this plan. If there are questions, you can be reaching out to Amanda, and she'll reach out to us, and we'll obviously provide any information we need. The other thing that's really unique about Humana is they will assign what they call an account concierge to your group. And this is a person who's dedicated to your group. So if we bring something to Humana, let's say you bring something to me about a provider, you're having an issue with a provider, maybe they're not willing to bill Humana, or you're having a problem getting something authorized, you would still go to Amanda, which Amanda would then reach out to us, but we would put the concierge in contact with you directly. And then you two would work one-on-one to resolve any issue there. To be honest with you, it's the only company I work with that actually offers that concierge service, and I actually love it. It's really, really handy. I will see about getting a copy of the PowerPoint presentation. There are certain rules with Medicare about what can be provided to retirees versus an employer group plan. So, but if we are allowed to share it with the retirees, I'll get it to Amanda, and then she can kind of make it available to you. So I kind of want to just go over a couple extra things that Jody really didn't have time to kind of get into. I want to make sure everybody understands the type of network this is. Okay, so again, this is called what they call a passive PPO network, which means there's going to be in-network doctors, and then there's doctors out of network that you can see. As Jody indicated, it's going to be the same copay in or out of network. The thing that you really got to keep in mind about using out-of-network providers is that it's going to make your life much easier if you're able to get that provider to bill Humana directly. Because they're going to get paid the Medicare allowance, and you're going to pay the same copay. So it's almost as if it was in network. There are going to be some providers out there that tell you they're not willing to bill Humana. Okay? You can actually still go there. I don't recommend it because what then becomes is it becomes a self-pay. You have to pay that provider. You then have to file a claim with Humana. And you would get reimbursed by Humana. The danger of that is we can't control what the provider's billing you. So if they bill you $200 and you pay $200 up front, and the Medicare allowance for that service is $100, you're going to get $100 back. Now, technically, that doctor's not supposed to bill you more than the Medicare allowance because they've accepted Medicare. Whether, I have seen where some providers are a little tricky like that. They try to get that extra compensation. And that can be controlled better if we can get that provider to send the bills directly to Humana and not make you pay up front. A couple other things I just want to point out, because again, she had to go through it pretty quickly. On the prescription drug coverage, you can get a 90-day supply through their mail order pharmacy. Humana actually owns their own mail order pharmacy called Centerwell. There's really no advantage to it because you can get a 90-day supply at your retail pharmacy for the same copay that you would get under the mail order. Some people may still choose to do the mail order just for the convenience of not having to pick it up at a pharmacy, but it's your choice. It's not going to be a cost difference or savings for you to use mail order versus getting the 90-day at the retail pharmacy. The other thing that I want to point out is the hearing aid benefit. That slide was a little misleading. You get one hearing aid per ear per year. It's not just one hearing aid. And then the other thing I'm going to point out is under the Excelis plan that you currently have, if you go out of network, there is an $8,000 out-of-pocket maximum that you could be on the hook for. And Excelis in this general area is great, right? They're extremely strong. But when you leave this area, you could face areas throughout the country where you don't have a network provider, an Excelis provider. And that out-of-network benefit comes into play. With Humana, we have significantly made the out-of-network much better. We've combined the in-network out-of-pocket maximum with the out-of-pocket maximum. So it's $1,250 under this plan total, in and out of network. So that's a huge improvement to the current plan structure. So, that's really all I have. I am going to stick around. If there's any specific individual questions you want to approach me with, I'll be more than happy to answer them. If there's any questions here that somebody wants to just ask in this setting, I'm more than happy to take them as well.